Okay, you have, this is A to P forearm with a 14 by 17 cassette. The central ray will be in the middle of your forearm. The epicondyles are going to be parallel. The marker is going to be to the left and to the right, and it's going to be placed lateral to the extremities. And you don't breathe and you don't move. This is lateral forearm with a 14 by 16 cassette. Your central ray is going to be right in the middle on the side of the forearm. The marker is going to be anterior to the extremities on the inside of the wrist, and the patient is instructed not to breathe and not to move. Okay, this is A to P elbow. The cassette is 10 by 12. The patient is seated and shielded. The central ray is perpendicular to the elbow joint, and the marker is placed lateral to the extremity on the outside. Patient is instructed not to breathe and not to move. Okay, this is medial oblique elbow. The cassette is 10 by 12. The patient is seated and shielded. The central ray is perpendicular to the elbow joint. The marker is lateral to the elbow, and patient is instructed not to breathe and not to move. Okay, this is lateral oblique elbow. The central ray is perpendicular to the elbow joint. The marker is placed on the lateral to the extremity. Patient is instructed not to breathe and not to move. Okay, this is the lateral elbow. Elbow is flexed 90 degrees and the thumb is up. The central ray is perpendicular to the elbow joint. The marker is anterior to the extremity, and patient is instructed not to breathe and not to move. I can't really do it, but this is the special elbow flex 1. Okay, this is really hard, but this is the special elbow flex 2. The first one, the body was like straight, but now this one, it's kind of off to the side. I don't know. This is 1 Holly, and the central ray is gonna be right there. Okay, this is the coil where my hand is just straight. This is the special views of the elbow. And then you have 2 coil, and my hand's gonna be out some. Okay, this is A to P humerus. Excuse my clothes on the floor. Sorry. Okay, A to P humerus. Okay, the SID is 40. The central ray is going to be perpendicular to the IR. It should come about right there. And the patient should be instructed not to breathe and not to live. Okay, this is lateral humerus. Oh man, my clothes. This is lateral humerus, and the SID is 40, and the central ray is perpendicular to the IR, and it's gonna come about like right there.